As one of our largest employers, we feel blessed to have Charles F. Kettering Memorial Hospital located right here in our city. Over the years, we have seen it become a world-class medical center. It's a wonderful facility and contributes so much to the health needs of our citizens. We appreciate all that they do for us and salute them on their 40th anniversary.
As I watched the tape interviews with the pioneers who started the Charles F. Kettering Memorial Hospital, I'm deeply moved by the unusual set of circumstances that brought people of such great inspiration and enthusiasm together. It is equally moving to think about how their work benefited the people in our community. These early pioneers were truly a blessing to all of us. I'm impressed with the way their passion and spirit lives on today in the dedication, talent, and skill of our outstanding staff here at Kettering Medical Center.
In its 40-year history, Kettering Medical Center has made a unique and extraordinary mark on its community. And yet, to truly appreciate the present KMC, you first have to look back, long before that first brick was laid, and learn how it all began. Charles Franklin Kettering, or Boss Kett to his friends, inventor, manufacturer, hometown hero. His list of inventions would fill volumes. At the time of his death in 1958, Kettering was second only to Thomas Edison in the number of patents held. His son, Eugene Kettering, and Eugene's wife, Virginia, dreamed of building a hospital as a living memorial to Boss Kett's lifetime of work and inspiration. The couple was impressed by the treatment of polio victims they've witnessed firsthand at a hospital run by Seventh-day Adventists. And they believed the Adventist philosophy of healing and Christian-based compassion was the perfect foundation for a new community-based hospital. The groundswell of support for their plan from the community and business leaders was tremendous. Nearly $2 million was pledged, and additional funds poured in from major donors. The Seventh-day Adventist Church, with its long history of medical excellence and compassionate Christian healthcare, was the perfect choice to oversee and operate the new hospital. With financial backing firmly in place, the facility was still no more than a spot on a grassy field where Boss Kett once tinkered with inventions. Now, leadership was needed to get the project off the ground. Young George Nelson, a successful hospital administrator from California, was chosen to manage the new facility. Nelson recalls his first meeting with the Ketterings.
We spent 2.5 hours discussing the plans, their hopes for the future, and so on. It was just a delightful evening. I learned that they wanted a quality hospital.
Nelson took over the reins of the project with confidence and a bold new vision.
Our mission was to establish and provide healing and comfort for the sick and injured in a comfortable, attractive situation, and where possible, to guide people toward a sound philosophy of life and a system of living that would prolong life and restore and maintain health.
On July 7th, 1961, ground was finally broken on what would become a remarkable healthcare institution. Nelson recruited physicians and employees from all over the country. Chaplain Brindle was part of that first family of employees.
You know, George Nelson just turned the excitement on as far as I was concerned, because he was a visionary. And I think that first year especially, we were all turned on by the excitement of starting something that didn't exist before.
After 2.5 years of design and construction, Kettering Memorial Hospital was officially dedicated on February 14th, 1964. More than 22,000 people toured the new facility during its first open house. The numbers for its first 6 months of operation were impressive. Nearly 3,000 patients had been admitted, 1,600 emergency patients treated, and 1,300 surgeries performed. There were 650 employees on the payroll. And an entirely new sound began filling the halls of the maternity unit. By the end of the first year of business, more than 1,000 babies had been born. The Kettering's original plan called for a school on the hospital grounds. In 1967, the Kettering College of Medical Arts opened as a junior college, offering 2-year associate degrees. It was the first program of its kind offered by an Adventist institution. Kettering College soon became known as a leading training ground for medical professionals. Through the years, the popularity and growth of the college has been unprecedented. In fact, the last 3 years saw a 33% increase in enrollment. Today, more than 650 students are enrolled, and bachelor's degrees are offered in nursing and health professions. A major capital campaign is underway to fund a much-needed expansion that includes new computer and science labs, a student union, and a learning resource center. Clearly, as the need for services at Kettering grew, so did the facility. By the late 1960s, the original hospital might have been hard to recognize. A 5th floor was donated by the O. Lee Harrison family. A new pulmonary intensive care unit was made possible by another generous gift from Eugene Kettering just before his death in 1969. Then, in 1977, the Northwest Addition brought 44 dedicated ICU beds, bringing the total number of beds to 415. Changes like these allowed the hospital to better respond to the community's needs. When the need for medical care increased in the south suburbs, Kettering opened Sycamore Hospital in 1978. The full-service facility boasted an emergency department, X-ray service, a clinical lab, surgery, cardiac rehab, and outpatient services. Heart care has been a hallmark of the Kettering vision since the early years. In 1971, a tiny nuclear pacemaker was developed here, transforming cardiac care for decades to come. Today, with its bounty of research programs and advances in medical technology, Kettering has become a leading cardiac care facility in the region and a pioneer in open-heart procedures.
We started off with a single lab occupying part of the radiology department. However, we soon grew so busy, we needed more space, more time, that the radiologists were very happy to see us leave into a separate department which was built by the hospital. It was grown from a single cardiologist performing heart catheterizations to 33 who now participate in the program.
Dr. Schuster, who opened the cath lab at Kettering, built the cardiac program with surgeon Richard DeWall, who performed Kettering's first open-heart surgery in 1966. On October 15, 2001, Dr. James Campbell performed KMC's 20,000th open-heart surgery. Kettering was the first Dayton area medical center to reach this lofty number. Kettering was the first hospital in the area to use positron emission tomography, or PET scans, for research and diagnosis. A new PET scanner installed in 1990 greatly expanded nuclear medicine research. Thanks to a generous gift from the Fred and Alice Wallace Foundation, the Wallace Kettering Neuroscience Institute, or WKNI, was formed. It quickly established a long-standing reputation for industry-leading research. Work in areas such as epilepsy, stroke, and tumor treatment has attracted some of the world's top medical experts. Installation of a gamma knife in 1999 further added to WKNI's high-tech arsenal. One of only a handful in the region, the gamma knife offers non-invasive surgery without a scalpel that's revolutionizing how surgeons are able to treat some neurological problems, such as tumors in the brain and spine. Next to the Ketterings, the largest contributor to Kettering Medical Center has been Oscar Boonshoft, whose specific interest in neuroscience was instrumental in propelling WKNI to world-class status. To commemorate Mr. Boonshoft's outstanding philanthropy, WKNI, which coincidentally celebrates its 10th anniversary this year, is housed in the Oscar Boonshoft Center for Neuroscience. In addition, his generosity made possible the establishment of the Boonshoft Schizophrenia Center, whose scientists research the causes and treatment of the disease, together with renowned specialists who treat its victims. We're profoundly grateful to Mr. Boonshoft, not only for his financial assistance, but also for his continuing involvement in the governance of WKNI. A host of other programs and facilities have evolved through the years in response to community need, like Kettering Reproductive Medicine, which helps couples achieve pregnancy. We also take screenings into underserved areas with the Wellness on Wheels coach. And Kettering's top-rated sports medicine program is focused on getting area athletes back into the game. The turn of the new century brought a showering of clinical quality awards and other honors. Kettering Quality Awards again took center stage in 2003, proving a major process improvement initiative was returning big gains. Sadly, Kettering Medical Center lost a founding visionary and leading advocate in February 2003 with the death of Mrs. Virginia Kettering. She was 95 years old. Her innovative spirit, a reflection of Boss Kett's, was a guiding force in her support of KMC over the years. Today, the hospital's mission of community care is as clear as it was 40 years ago, still firmly rooted in the vision of the Kettering family and the compassionate healthcare beliefs of the Seventh-day Adventist Church. Perhaps no greater event affected the community's access to care more than the merger of Kettering and Grandview hospitals in 1999. The combined geographic coverage of the Kettering Medical Center network is unparalleled in the region. In addition to 5 major hospitals, the network includes key satellite facilities like the Inglewood Health Center, the Kettering Breast Evaluation Centers, and the Sycamore Glen Retirement Facilities. After 40 years of unprecedented growth, it's not surprising that KMC Network is now the fastest growing healthcare provider in the Dayton area. And with more than 6,800 employees, it's the 4th largest employer. Yet, serving the community means more than caring for its medical needs. It also involves caring for the community's charitable needs, with projects like the Walk for Women's Wellness, which last year drew 2,400 supporters. The event, which raised nearly $115,000 last May, has funded more than 2,100 mammograms for underserved women over the last 10 years. And the community is reaping the benefits from robust United Way contributions, both on the corporate and individual levels. Over the past 2 years, KMC Network and its employees have raised $420,000.
The 40th anniversary is a signal event in our lives because it reflects what has been given to the community by this wonderful organization. As a physician, I can speak personally that as much as we've given, we have received more in return, and that's the real reward and the real honor of being part of the 40th anniversary.
Dr. Vernon Luthus is a fine example of a physician who was given to the community. He was on staff from 1964 to 1992, and in retirement he started the Kettering Medical Center prayer team with 5 other Christians. Today his prayer team is 40 people strong, praying with patients and helping them through trying times. The team gets great fulfillment from expanding their relationship with God and sharing His Word. Many patients report they enjoy being treated in a Christian hospital, citing Dr. Luthus' prayer group.
I am convinced that our past successes and our future achievements will be fundamentally tied to the relationship of a Christian, faith-based institution that embraces the Seventh-day Adventist mission for health care.
To be a part of such an outstanding organization, as evidenced by the numerous awards received during the past few years, is my greatest privilege. We are on solid ground financially and will continue to grow the medical center and push the envelope from a technological standpoint. Most importantly, however, we are continuing to fulfill our mission. We are committed, each and every one of us, to conveying God's love in a caring environment. Our efforts at Kettering Medical Center are making a significant difference in the quality of life in the communities we serve. I'm deeply grateful for being a part of this mission.